Hello everyone, how are you doing? My name is Ismail Elkhattib and today I'm going to talk to you about the CS exam. First of all, I would like to introduce myself. I'm an international medical graduate basically from Egypt and I'm SFMG certified with very good scores in USMLE Step 1 and Step 2 CK, and I passed my USMLE Step 2 CS exam uh, with high performance. I got my results in August 2016 and I took my exam back in LA in June 2016. Today I'm going to complete our journey about the CS exam, and this will be a whole review, a comprehensive review about the CS exam. How does it look like? How do you study? What do you need? And I will answer a lot of questions. And then there was a previous video you can watch about the tips of CS exam. First of all, what is the CS exam? The clinical skills component exam that's only held in the United States. You have to take it to be SFMG certified. It's how does it look like? What is the format of this exam? So it's a 12 patient encounters and each one is 25 minutes. It's divided into 15 minutes to stay with the patient, the patient encounter itself, and then 10 minutes to write the patient note. And I'll show you what should you do through all these encounter and what does the patient note looks like and what should you write in it. Third question is time needed to prepare for this exam. It's really individualized. I know a lot of American friends who just prepare for a few days because they have the whole fourth year of their medical school preparing for this exam. Others that just took step 1 and step 2 CK, they may study just for 2 or 3 weeks. Others may need maybe 5 or 6 weeks. So according to your basic knowledge and what do you need. But this is generally what you need for the CS exam. What's the fees? It's $1,500 American dollars, and the visa if you apply for the exam, they will give you a permit or a paper to support your situation. We're going to get the visa from the embassy in your country. How can you prepare for this exam? It's just you have to follow my recommendations and you have to check experiences from others and to follow how did they do it so you can do it too. And just remember this, the cornerstone of passing this exam is to practice a lot. This is the secret. This is the thing you should do many times over and over with different people and with people who already passed the exam. The other question is what sources should we use? I highly recommend the First Aid 5th edition. Is a very good book, and it really contains a lot of data that is necessary for this exam, but you'll have to apply them all, and if you did so, I will assure you that you'll pass the exam, but you have to do them all. Why do people fail in the exam? I will answer this question in a couple of minutes when we check the statistics. From the USMLE.org side, they say why people fail, in which component, because as you know there are 3 components that you need to pass in them, and failing in one of them will make you fail in the whole exam. What's the importance of passing this exam from the first time is very important. A program director looking at your CV and then he sees that you failed in the CS exam, will think that you'll have a problem with dealing with the patient, with talking with the patient, maybe with your English language. So they will be very afraid to hire you. They will think of others and they will put you at the bottom of the list. So make sure that you try to pass it from the first time. It's not the end of the world, of course, if you didn't pass from the first time, but you should. This should be your target, and especially it's an expensive exam and you have to travel to the United States to take it. Tips to pass the exam is the previous video. As I told you, just watch it and you'll find out. Where should you take the exam? As I told you, it's present in the United States in 5 centers only. 4 of them are almost in the east side, Chicago and Philadelphia in the northeastern side, Atlanta, Houston in the southern eastern side, and Los Angeles by the western coast. How does it take to get your results? Actually, it takes around average of 2 months. I took my exam here in 2016 in the middle of this period on 4th of June, and then my results was available on the first day on the 17th of August. Usually, 90% of all this testing period appear on the first day, and the rest appear on the other days until the end of the reporting date. The 10% is just for quality and this stuff, so they are a little bit delayed. But usually, as I told you, 90% are reported on the first date. This is the reporting schedule for 2017 from the USMLE.org site, and I would like to refer to this date, July 15th. Remember it, it is the last date that you can get your results by September 13. So this is the last date that you can take the exam if you are applying to the match of 2017 and you want to be SFMG certified on the first day, because SFMG certification takes 2 days. So 13 it will be available on the 15th, which is the first day of applying to residency, the first day of the match. Talking about or speaking about the three components of the CS exam, the first of them is the CIS, it's the communication and interpersonal skills. What's the communication and interpersonal skills? It's like your body language. How do you communicate? You should talk into the patient in a language he understands. As they say, you should be in the patient shoes, not in your language. Do not use difficult medical terms. You should always have a good eye contact with him. You should always do the perils. Perils is just a mnemonic. It contains support, sympathy, and it's like when the patient is telling you, "Oh, doctor, I'm having a terrible pain." It's like you should show some respect to him. You should tell him, "Oh, I'm sorry to hear that. I will do my best to help you." That's empathy. That's you're showing also support, and you can do this in many occasions. So the first aid, and if you take a course with me, I will describe to you when should you use it and how do you do it. You can read the data, but you can stop the video and read it. I will not go through every single word. It's just a comprehensive overview. Second is the spoken English proficiency. Spoken English proficiency is very important component also. It's how clarity your spoken English. Usually you don't have to hesitate when you speak. It's no problem when you're having an accent. Everyone has an accent according to his native country, but you should speak a very clear English that the patient understands you from the first time. The patient doesn't have to, "Can you repeat that, please?" And you don't have to do that well as well to the patient. You have to understand from the first time. Also, you have to use what we say, avoid a lot of wordness. You should make word choice, like you're asking a question to the patient, you're asking about if he's having a palpitation or not. You cannot say, "Oh, sir, do you feel like sometimes your heart goes up and down and you feel there's a problem with your heart?" That's too wordness. You just have to say, like the first aid suggests, "Sir, do you ever felt racing heartbeats?" So it's just simple question. It applies to most symptoms and signs. You have to ask according to the way it's proposed by the first aid or a simple one. Lastly is the most common component to fail in. Like I will show you the statistics in a while. So the integrated clinical encounter, it's the data gathering component. It's the real clinical component. It's when you are with the patient, how do you ask him about taking the history in a complete manner? How do you do the physical examination? How do you tell him your closure and the encounter with him and discuss to him his clinical diagnosis and tests you're going to do with him. And I will going to describe this more in a detailed manner in a while. There are some reasons why people fail in this, and the patient note is also another way when you fail in it. So it's a very common component also to fail in the patient note, and you will fail in the integrated clinical encounter, and then you will fail in the whole exam. As I told you, failing in one component equal failing on the whole exam. You have to pass in the three components to pass that. to pass the exam. Here, like some, I would like to take some examples. So something like using non-medical terminology, like you're in the diagnosis telling that this patient having a pulled muscle. There's nothing a medical terminology called this. There is a strained muscle, maybe a bone fracture, but there is nothing called pulled muscle. So this is one of the mistakes that can lead you to fail in this encounter. Going to the statistics to look here, it's the United States Canadian schools. Here is the international medical graduates such as MI. So here is the most recent one, 2014 and 2015. The first taker, they usually pass by 80%. So 20% fails in the exam, 1 every 5. It's very high. And according to the more detailed which component do people fail, look at the second line is international medical graduates again, and look to the most recent ones. So the the integrated clinical encounter is the most one, with only success rate 86%, 14% fail, 9% fail here, and spoken English proficiency, like you have to be very bad. It's almost all people, 98%, they pass this one with no problem. So talking about the first aid, overview of it, how does it look when you open the directory of the book? First section is just about the cities and the hotels there, and what to visit, what to do in the cities is just a general thing, not so related to the exam. Section 2 is related to exam. It starts by the introduction, doorway information. The first thing you'll see in your exam, how does it look like, what information is written in it, and then how do you take the history, how do you do the physical examination, how do you end the encounter through the closure, how to interact with special patient. Usually there is 1 or 2 special patient, an angry patient or an anxious patient or patient in pain. How do you deal with him? They are shouting at you, they are anxious, they're telling you be quick, and how can you deal with it? Because if you didn't deal with it, the patient may ruin your encounter and make you feel very uncomfortable. So you have to train yourself to this situation, and it's written all in the first aid. Then the first aid discusses the challenging question that the patient may ask you. Usually the patient asks you this in the closure, as I will tell you in a while. Also, you should do what we call counseling and the patient note lastly. So taking the history, it starts from the first part of the it's just introduction. What should you do? How do you knock the door? You should get inside. How do you talk to the patient? Greet yourself, telling your name, telling him your position in the hospital, and then you go to the history. You have to analyze the main complaint in a very good manner. So someone with chest pain, you have to ask him how many does it come, when did it start, where is the location, does it radiate, what's the severity, what increases, what decreases, is it constant or progressive? So you have to analyze it in a good way, and then you have to ask about another system and another aspects of history as it's shown in the book. And there are some tips that you cannot rush or interrupt the patient. You should maintain eye contact. Then before doing the physical examination, you should summarize by telling the patient again the only positive symptom. You should say to him, you came for us today because you had 1, 2, 3, but you should not say you don't have cough, you don't have vomiting, you don't have diarrhea. You should not say any negative symptom, just the positive symptoms. Secondly, the physical examination. Make sure before you do it that you wash your hands or wear gloves. You are free to do each one of them. And during the exam, you should keep it very focused to the system you're doing the examination on. Do not repeat painful maneuvers. How can you make a focused exam? Like if you're doing chest examination, you have to do a full chest examination, and then nearby or other differentials. So maybe do a cardiac auscultation, maybe do abdominal palpation. So that completes your examination together with the general examination. You don't have to do a neurological examination. It's only 4 minutes, and you cannot do all. Lastly, the closure. And the closure in the encounter, you have to make sure that you do the 3 things. First of all, you have to give the patient your clinical impression. Then you have to do the counseling, advise him about bad habits, advise him about stop smoking, stop alcohol use, and maybe use condoms if he's having a bad sexual habits. And then lastly, you have to tell the patient, ask him if he has any questions, any concerns, and then there will be the challenge question. Usually each patient has 1 challenge question, and you have to answer it in a professional, good way. This is an example of generic questions. I already told you something like he may ask you, do I need antibiotics for my disease? Do you think I have a fatal disease? Do you think I'm going to die? Someone with HIV, do I have to tell your wife? And the first aid have a very good suggestion and a very good way in answering this question. You have to train yourself. Then here we finish the clinical encounter, and here we're going outside the room, and we will set on a computer and note the patient notes. Here is the patient notes from the USMLE.org. You can use them. You can note them. They are just the same in the real exam. They start by the history and then physical examination. You should write the most positive or relevant points, and then you can go and write the diagnosis number 1, 2, and 3, and each one with the supportive evidence. So chest pain, you should write in the history finding what's supporting this. You cannot, it's 20-30 minutes. It supports that it's myocardial infarction, here the diagnosis, and then it increases by exercise, decreases by rest. You can add another row and write, for example, it decreases by sublingual nitrate. So all of this supports that it's a myocardial infarction. And then physical examination, maybe you can say you heard the heart murmur or something. Second differential maybe a pruritus, and then you can say that it's stitchy pain. In quality, it comes and goes, so that support that it's your secondary diagnosis. Third one may be GERD. Maybe you can say that it comes during night, so that support that's GERD. And then studies or diagnostic studies. So there are some general that we write to everyone, like CBC, complete blood count. Here in this case, maybe we can write ECG, cardiac troponins, maybe pH monitoring of acid in the stomach, maybe chest X-ray. So whatever you think what that will help in diagnosing this patient. Last section in the first aid is about the two sections for the cases, mini cases and practice cases. Mini cases just they write the symptom and what's the differential of this symptom and what's the relevant thing you'll find. Practice cases are complete cases. It's like they write you doorway information with a patient name. For example, Mr. Clark's 46 years old. He's presenting with chest pain, and then you will have to practice this with someone. So they will write instructions what the simulated patient should do and a complete history. Like he will answer you what's positive and what's negative, and then there's a model answer, model differential, and the model closure, a model physical examination. What should you do in this case? How should you write? You can also train yourself to write patient note, and there will be a model answer for the patient note. How should you write it for this case? So it's very good for practicing, and usually do not rely only in this practicing. You have to practice with someone who can tell you what are you doing wrong, what's your strengths, what's your weakness, and give you a full assessment about your performance. This is an experience of someone who failed on the exam. I put someone who failed, so to look at his experience. He just took the exam on 2016, and he's saying what did he do next second time to pass. And the importance of doing something like a mock exam, because it tells you what's your gives you a feedback about your strengths, your weaknesses, and this is what I'm offering through my course and through my online sessions. I can make a mock exam or make some cases with someone and give him a full assessment about his performance, his strengths, his weakness, and whether he's going to pass or fail in the exam. This guy's name is Danish. You can find it on Facebook groups. Lastly, these are my tutoring options. I have two options. I have a course. It's 10 sessions, 2 hours each. It's a comprehensive course discussing everything. It's online. Secondly, I can make a mock exam. I can make a test exam. It's live on Skype or another program I use called Zoom. It's for 4 hours. I can do for 8 cases for you, so 25 minutes for each case and a break in between. So it's almost 4 hours. I can give you a full assessment to your performance, including strengths and weakness. And lastly, a final report about when you're going to, whether you're going pass or fail from my experience in teaching a lot of a lot of students, and from my exam experience. My last advice, and it's very important, just do it once, do it right. So just one time, you don't have to do it 2 times, you don't have to spend a lot of money, you don't have to glue your CV, just do it in a right way and you will pass. and I'm always here to help. Good luck to for you all, and this is my picture, and this is my contact data. If anyone wants to contact me, this is my email, my Skype, my Facebook, my mobile. I'm here in Chicago, so anyone wants to ask a question to contact me, I will be glad to answer all your questions. And good luck to you all. Thank you.